It's Dr. Rachel Brown again with Business Health Solutions at Prisma Health, and this is the weekly Business Health COVID and Wellness Update. It's been a big week. Phase 1B opened on Monday, and it's been fast and furious across the state trying to get as many shots in our new eligible residents as possible. Want to let you guys know that the recording date today is March 12th. So if you're watching this after March 12th, be sure you check to make sure all the information is up to date. Let's get right to it. Incidences of our cases are down in all of our counties. Our percent positive is down to 5.5% average across the state. That's incredible. We're very happy with those numbers. That is due to the fact that folks are following precautions. We may be seeing the initial sort of early impact of getting folks vaccinated, but that's so early on in the process that this is mostly in part to following precautions. Of course, getting folks vaccinated is the most important thing right now. So let's go right to the DHEC site so you can see who is currently eligible. Most of you have probably heard this already, but we are now opening up vaccinations to our 1B phase folks. So that includes school and childcare staff. That also includes anyone age 55 and older. Folks younger than 55, 16 to 54, who have medical conditions listed here, and frontline workers who have increased occupational risk. We also are seeing folks who are in group settings that are at risk added to this list, okay? Let's back up a little bit since this is a business health update and look at this category of frontline workers with increased occupational risk. Please understand that there is a difference between the categorization of essential businesses and this categorization, which is essential frontline workers. And it really is very much dependent on whether those workers are in an essential area of business for our state, but that are at higher risk. In other words, close contacts. They're not able to reduce their exposure risk by separating, by being socially distant. So please be thoughtful when you're considering your workforce. You may have some on your workforce who meet these criteria. There may be others in your workforce who are either working from home or who are able to work from offices or who can socially distance. They should not be prioritized at this point, okay? Let's really stick with who is at the highest risk and prioritize those folks. And here's why. I don't think it's a surprise to anyone that when we opened phase 1B, we added almost 3 times as many folks to the eligibility pool that were in phase 1A. And yet we haven't seen a comparable increase in the supply of our vaccine. So now we have a very, very large pool of folks who are eligible for a very small amount of vaccine that South Carolina is getting each week. We also have prioritized many, many different groups, and it's difficult to suddenly pin one or another of those down and say, well, they're more essential, or we are going to prioritize them in a higher category. Everyone in this eligibility group is very important, but you're going to see and feel the struggle between such an increase in demand and a decrease in supply. And that's happening across the state. So just as an example, for Prisma Health, a week or two ago, we requested more than 58,000 vaccines for that week. We received a little over 18,000. That is the case for all vaccination sites. So we simply don't have the supply to get all 3.7 million folks who are eligible right now their vaccine immediately. So we are doing our best, and here are some of the things that we're doing. So one of the ways that you can encourage your employees to pursue vaccination is to check out our web page. I'm going to go to that now. I can get this to move. There we go. All right, and you can see here, you can check to see if you're eligible. You can click on this button to get the vaccine. Now, when you click on a button that says get the vaccine, that doesn't mean you're getting the vaccine. It means we're showing you how you can register, okay, and look for appointments. So folks who have access to Wi-Fi and computers and feel tech savvy enough can register for MyChart here, or you can call this number and we will assist you in signing up for an appointment for a vaccine. Now let's talk about what that means in the context of such limited supply. There may not be appointments available. Prisma Health and many other vaccine administrator sites are waiting to post their appointments until they actually have their supply and know the numbers. So you may not see appointments available right away. You may try and they get gobbled up immediately and you're going to have to try again. The good news is that Prisma is working on making that process even easier for you, with the idea that once DHEC has moved to a slightly different system of assigning allotments, where we have a bit more predictability and an understanding of a baseline amount of allotments of vaccine that we're going to get each week, they are going to be posting their new appointments on Tuesdays and Fridays. So look for that announcement, and that will help a little bit so that folks are not having to continuously go back to the website over and over and over again, and at least can focus on a couple of days. That way we get our vaccine, we know how many appointments we can offer, we add the appointments, the community can take a look, and if they're already registered with MyChart, they can sign up for one of those appointments. They're going to go fast. There are a lot of people trying to get this vaccine, so encourage folks to keep trying and to be patient. All right. Let's see. Want to remind you all that Prisma Health uses the Pfizer vaccine, which will mean that folks will need to get 2 doses of that vaccine, one on their first trip, and then 4 weeks later, a second dose of the vaccine. We did get a little bit of Johnson & Johnson, or the Janssen vaccine, which you may know is the 1-dose vaccine. We hope to get more. We don't know how much of that is going to be placed on our doorstep, but that vaccine is being utilized for some of our vulnerable populations that don't have the ease of access to vaccination sites, maybe don't have the ease of access to technology, maybe don't have Wi-Fi or computers, or don't feel that they are digitally literate enough to manage that, that have transportation issues, who may be homebound, rural folks who don't have the same kind of access to vaccination sites and to healthcare in general. So we are really trying our best to use the tools that we have to reach lots of different populations. And again, I cannot reiterate enough that there's more demand than supply. And so we're going to have to chip away at this one bit at a time. This process, by the way, is highly data driven. It is not random at all. And we have experts and an amazing group of people at Prisma Health who are looking at who are those vulnerable populations. And if you're interested yourself in evaluating your own community, take a look at the CDC's Social Vulnerability Index page. This is part of what Prisma Health uses to determine who needs us to adapt our vaccine efforts so that we can reach these folks. And I'll let you take your own time to go through this site, but just let me highlight here that there are 15 different social determinants that go into determining whether a county is a vulnerable index. And we use that information to help us know where we can make the biggest impact in terms of, say, bringing a 1-dose vaccine, or maybe utilizing the mobile unit instead of encouraging folks to sign up to come to our community sites. Prisma Health is also partnering with schools. That's very, very important to us. We do prioritize every area, every group of folks who are listed in 1B, but we're working especially with schools to do special events with them. We need to encourage you to be patient in requesting on-site vaccine clinics. The supply is very low. Okay, so we're not able to do those types of on-site clinics that you may be used to with flu clinics. We're also making sure that folks who cannot travel or who cannot access community sites easily are the ones who are prioritized for our mobile clinics and those kinds of efforts. So please be patient with us. There will come a time, I promise you all, where we're sitting around begging folks to come in and get their vaccine because it's going to be so accessible. Now is not that time. Also want to make you aware that on our Prisma Health website, when you click on Find a Vaccine Site, that's going to list our 6 community vaccine sites that are within the Prisma Health system. Let's see if we can get there. And it's going to show you which sites are available for walk-ins or not available for walk-ins for first and second doses. I also want to highlight that the Toomey Hospital vaccination site is closed and will reopen at the Civic Center next Monday. So this is wonderful. We're excited about our partnership there. I think that's going to increase access as well. All right, let's talk about another avenue. Okay, so that's what Prisma Health can do for you. You can also visit the COVID-19 vaccine page with DHEC and click on, forgive me, at the top, click on Find a Testing Location. Okay, that's going to take you to this page, which I've already brought up. And you can plug in a zip code. It's going to list outside, including the Prisma Health System vaccine administrator sites, the other healthcare systems vaccine administrator sites, pharmacy sites, DHEC sites. And again, you can see, are they accepting appointments? So this is another way that you have some choice for your employees to go ahead and get that vaccine. And some of these folks are going to have appointments listed way out, weeks and weeks and weeks out. So do not be surprised. No one is overflowing with vaccine supply. So all of us administrators are having the same challenge of balancing that demand and supply, but you certainly can check it out. Here's lots of different options here that you can explore. The other thing we're looking for is a self-enrollment portal that hopefully is coming from DHEC soon. And also wanted to report on something DHEC is working on called regional advisory committees. And they're starting to hammer out what the role of these committees will be. But the bottom line is regional representatives across the aspects of administering vaccines will be meeting to figure out how do we prioritize, how do we increase access, and how do we support our communities, and especially our vulnerable communities that can't easily access these sites and access pharmacies. All right. In essence, I want to let you know that Business Health Solutions is collaborating with other other Prisma Health departments so that we can bring our vaccine to our vulnerable populations. And this is determined in a data-driven way, as I mentioned before. Others of your employees should pursue community sites and have that choice available to them. Everyone has limited supply, so please be patient with all of us as we try to vaccinate everyone, okay? If you're interested in seeing how we're doing across the state, you can go to the COVID-19 vaccination dashboard. You can see here, we've got 832,000 residents who've at least gotten their first dose, and we have 470,000 residents who are done, who are vaccinated. This is wonderful news. Okay, so keep your eye on this. I like the number of percentage the most because that tells us how well we're doing. We've got 11.5 people fully vaccinated in South Carolina. We've got 20% who've gotten started. So this is really a fun site to look at to watch our progress. I'm going to stop sharing the screen for just a second. And I'd like to talk to you about what you can do now, because we understand the frustration and we understand the imbalance between what we're able to provide in terms of number of vaccines and how many folks would love to be vaccinated at this point. So your first step is encouraging your employees to pursue the mechanisms I just explained, I just showed you, whether that's through Prisma Health directly or through the DHEC Vax Locator, and just have them working on getting registered. We can help your folks do that. You can either call that number, or Business Health Solutions can come to your organization and we can do trainings. We can get people registered. We can do trainings for your team so that you've got a registration team that can help your employees. Please utilize us in that way. The other thing you can be doing now is addressing vaccine hesitancy, because the higher percentage of South Carolinians we get vaccinated, the closer we get to being able to go back to that life and doing those things that we may be missing right now. goodness knows we all want to take those masks off and feel good and comfortable about having those masks off. So the more folks we can get vaccinated, the closer we get to that. Please let us help you. If you have a portion of your population or a workforce that has questions or vaccine hesitancy, we can provide education by sharing these videos. We can come on site and do educational sessions. We can do that virtually, whatever it is that you would like us to do. I'll also refer you to the CDC Essential Workers COVID-19 Vaccine Toolkit. Simply put that into your search bar, and you will find a host of materials that you can use and share with your employees that are very helpful. And then finally, I encourage you to encourage your workforces and your leadership to be patient and to model patience. We have far, far, far more folks who want to get the vaccine than we have vaccine. That will not be the case forever. So if folks can remain patient and hopeful, and especially remain professional and kind. So we understand that folks are frustrated. We understand that folks are weary and want to get and to feel that hope and relief from getting the vaccine, but anger is not going to help the situation. So if you can encourage everyone to stay calm, to wait a little bit longer, we will get to a place, I believe, quite quickly, in which folks are not having the same kind of troubles and frustration with being able to access the vaccine. So let's talk a little bit about some of the CDC recommendations that have come out recently. I've already talked to you before about how if you do begin to see folks in your workforce who are vaccinated, if they report an exposure to COVID and they have no symptoms, they do not have to quarantine. So if that was something that you've been doing to keep folks safe and to keep outbreaks from happening at your organization, you now can allow those folks to work and just monitor for symptoms for 14 days. That's also the case, by the way, for folks who have COVID-19. So after their 10 days of isolation, for 90 days following that, if they have an additional exposure, they are considered pretty darn protected and they do not have to quarantine. The CDC issued some recommendations this week that indicate two things. One, hope, and the other, a little bit of hesitancy, right? So we're going to see this over the coming weeks as we gather more and more data from the bigger and bigger number of folks who become vaccinated. CDC is going to be able to tell us a little bit more about what we can feel comfortable doing. And a little bit of that started this week, and that's a good thing. So we found out this week that it's probably okay if you've been vaccinated, if you're hanging out with other vaccinated folks, to be unmasked. Some of you may have already been doing that a little bit. Turns out that's fine. There's also an interesting recommendation that was put out that if you have been vaccinated and you visit with a household where there are members who are unvaccinated, as long as they are at low risk, that's also probably okay to do, unmasked and gather inside with one other household. That recommendation kind of tickled me a little bit. That's a tough one to figure out, but it's out there. And I think what we need to take away from that is that things are moving in the right direction. We'll hear more and more of this. Okay, we think it's fine for you to do these kinds of things going forward. Remember that recommendations are recommendations. They are guidelines. Nothing trumps common sense. Okay, so just using common sense around some of these issues. We know that right now following precautions is what is keeping our cases low. Vaccinations are a part of that, but it's still really primarily due to following precautions. So let's just do the right thing for a little bit longer till we can get past this and then start feeling more comfortable with not doing that kind of thing. All right, remember that we are masking still because the vaccines aren't 100% effective. They're phenomenally good, though. Gosh, it's so exciting to see. It's also because we don't know 100% yet whether someone who's been vaccinated can't transmit the virus, although the preliminary data around that looks pretty darn good that we cannot. And also because we've got this variant issue out there that we haven't fully flushed out. So keep the masks on. Keep washing your hands, keep social distancing. It's beautiful weather now. Let's gather outside instead of inside, and I will see you in a week.